if you have a physical ailment and you go to a doctor and the way that the doctor shows up or their recommendation or their protocols don't align, it's a pretty easy decision to change doctors, right? It's a no-brainer to say, you know what, that's not for me. I'm gonna get a second opinion, or I'm going to go elsewhere. However, for some reason, I found that when it comes to pregnancy, a lot of the women that I work with and know feel some sort of obligation or responsibility to stay with their provider that they've started with, regardless of how that provider shows up. It's really common once a pregnancy occurs to stick with the gynecologist that you've seen for prior years for your annual physical or for checkups, etc., or to ask for a recommendation from someone in your community, like one of your friends who's had a baby, and to go there and say, okay, well, this is what I'm dealing with. Or even to go on the insurance website and whoever the first provider is, if you have insurance, just go there and stick with them. It's almost this feeling, at least I'll speak from my personal experience, when I started seeing during my first pregnancy, my first OBGYN, I really, really liked her, but I also didn't want to leave her. It felt like there's some sort of like obligation to stick with her through the whole journey just because I had started with her. And what I want to offer today is the invitation to explore other options if the provider that you have right now doesn't feel absolutely perfect for you. The way that we have our needs met and the relationship during early pregnancy is very, very different in terms of provider relationship as compared to later in the pregnancy or the delivery. So it's often, in the early days, for the first couple of visits, we're making sure that the pregnancy is viable. We're worried about the morning sickness, or is this symptom normal, or the way that the doctor can show up and support you for the early scans is very, very different than what the doctor has as a labor and delivery protocol or guidelines or standards. There are a lot of questions that may be worth asking the provider at any point, but earlier on is certainly easier, so you have more time to find alternatives if this provider doesn't align with your vision. But asking the provider, do you allow for pushing in other positions? What's your cesarean rate? How do you feel about different pain relief measures? Can I have a doula at my birth? What is the labor and delivery staff like if the provider works with a hospital? There's a lot of questions, and I have a whole list I can send you if you're interested. So please feel free to reach out to me at lizzie@lizzieliao.com if you would like a whole list of potential questions to ask. But there's many things that you can ask to get an indication or a sense of what kind of doctor they're going to be or what kind of midwife they're going to be throughout the whole pregnancy and for the labor and delivery. And again, if they don't align, if their energy doesn't feel connected, if their responses don't make you feel good, go and look for other alternatives. You are not bound to the one that you started with. And that's true all the way up toward the end of pregnancy. Now, when I was pregnant with my daughter Lila, I had a provider. I was living in Shanghai at the time, and I loved her, and I was good to stick with her, actually. Everything felt like it made a lot of sense. There was a doula, there was a midwife as well. It was like a great team. An unexpected move back to the States during the early COVID days meant that I had to find a new provider, and I moved back to the New York area. The combination of COVID, as well as, I suppose, the competitiveness or the liability fears of many of the doctors and hospitals meant that I was turned down by a lot of doctors because I was 16 and then 17 and then 18 weeks pregnant, and I was considered to be too far along by many, and I felt really stressed. And I was like, oh my gosh, these people won't even take me. This is crazy. I should just be in Shanghai with this original doctor. However, once I relaxed and started asking other friends, doulas, and contacts for support and help, and got other people on board on the mission of finding not just someone that would take me during the pregnancy, but someone who would feel aligned for the type of pregnancy and birth that I envisioned, multiple options flowed in. And I ended up trying out another doctor, another OBGYN, and then eventually switching to a team of midwives who worked out of a birth center. And all along the way, I asked questions. I checked in with my intuition. Is this the right provider for me, as I interviewed other options? And I have to say that coming to a decision that was really fully my own, also with the support of my husband, Warren, and really coming to a decision where I felt safe, supported, and seen, made a world of difference when it came to my overall pregnancy experience, the meaning that I make of it, as well as the labor and delivery. So too did that happen with my second pregnancy, when I started with my same midwives, who I absolutely loved to the moon and back. They're amazing, but we moved and we were living much farther away, and doing very long commutes to see them no longer felt aligned. And so even though I loved them, I started exploring other options for other midwives that were located much closer to our new home-based location. And very quickly, after doing a couple of phone calls and a couple of kind of light interviews, I found a midwife who was super supportive and exactly the type of person that I knew I wanted to work with for the rest of that kind of segment of my pregnancy. I ended up moving to Spain at the end of the pregnancy, around 32 or 34 weeks. And again, did that same process of interviewing, finding people who not just would accept me based on insurance or based on availability or based on fill in the blank, but providers that really did make me feel good and could answer my questions in a way that made me feel like I could really trust them and feel safe with them. So I'm someone that has switched around a lot, probably way more than what is common. However, I just want to use that as an example so you know that if you are finding yourself at 20 weeks and you're already questioning who you're seeing, or you're finding yourself even in your early third trimester and you're finding out that their vision of birth or their birth statistics don't feel good for you, you always have the option to look at other places to find other providers. And I talk about this in another video, but you don't only have to work with an OBGYN. There are some OBGYNs that are absolutely fabulous, the best out there. And if you have a high risk pregnancy and you know that cesarean birth is something that you're going to want or need, then that's the ticket. That's the kind of category of care provider. But there are also a number of absolutely amazing midwives who are trained in facilitating pregnancy and birth and see it as a normal life event, who can do everything pretty much except for surgery when it comes to birth. And they might be an option. The midwifery model is quite different in terms of the type of care and the kind of the way that the midwife shows up for the mom and family. So I highly recommend that you consider that as well on your kind of list of options if you do look elsewhere. So with that, I'm complete. Thank you for tuning in as always, and I wish you a beautiful day and a wonderful pregnancy with the right care provider for you ahead.